Hello. Now that you have seen the movie and the band played on, let's meet two guys over here that are the real heroes of public health. We have got here Don Francis, the real one, and over there, Dr. Claudio Amaral. They both worked together in India with the eradication program of smallpox eradication program. I put a few questions to Don here, and very simple ones, I guess. For you, what are the main lessons that can be learned from what is presented at that movie about the experience that you had?
Well, I think both Claudio and I, who work in public health, follow the rule that it's a scientific profession, that you understand the epidemiology of the disease, you figure out what to do to prevent it, and then you act accordingly and then assess it. And it's the same thing whether it be with smallpox in India or HIV and AIDS anywhere. It's all the same. Understand the disease, make the best recommendation of how to control it. If you have a tool, like we had in smallpox, of a vaccination, you use that tool, but you still go through the scientific design and the scientific assessment, and you do what's best for the people. The challenge there is that there's often obstruction, be it not enough money or some bad political leaders or whatever. No matter where you are, it's always the same. And no matter what profession you as students go to, you'll have the same obstruction. And how do you manage around these things or over them? When do you push hard? When do you push quietly? It's always a challenge in public health or in education or anything else.
The movie is quite good because it illustrates the complexity of public health, besides science by itself, isn't it? So I would put a question that I know that's not easy, perhaps, to answer after all these years. But those days, did you believe that it was possible to control or to stop the outbreak of AIDS? At some
yes,
time?
yeah. Well, we already saw, by the end of that movie, we saw that many of the gay men in places like San Francisco had decreased their behavior spontaneously without public health doing anything but describing the disease and telling them what they thought was was causing the disease. And people are smart; they will change their behavior. Now, the problem with that behavior is it can only change so much, and then you still have this terrible number of infections that we have continued around the world. And you can still try to change the behaviors, but ultimately you're going to have to make a vaccine to stop these diseases, and we've known that for many, many diseases.
Yeah, that's what happened with smallpox, you see. That was a challenge, a battle of public health. And Dr. Francis and Dr. Claudio were one of those who fought that battle and managed to succeed. That was a great success in public health. And nowadays I know that Dr. Francis is working on with the dengue vaccine. That's a great hope for the future to control this disease that is devastating all over the world. Brazil, it's terrible. Thousands of cases every year. Do you foresee that for how long will you be able perhaps to have a dengue vaccine and to eradicate dengue like smallpox you managed to do one day?
Well, dengue vaccines are still early, but there are at least 4 prototype vaccines that look very, very good. And one of them is beginning an advanced study right now in Thailand, and there will be one or more being tested, manufactured and tested in Brazil in the next 4 years. And they're very modern, beautiful vaccines in the virologic sense, and they all work very well in terms of the safety in humans, and they produce the immunity in humans. And they protect animals, but the animal model, you really have to protect humans. And so, in the next 3 years or so, we will be doing trials in Brazil and elsewhere to see if it will actually, how protective it is. And I'm very optimistic. These are very exciting vaccines. They're kind of the new generation of modern vaccinology. Dengue is very tricky because we know that you can make things worse with dengue if you're not careful, so they have to be very carefully studied in safety. But I'm very optimistic certainly in the next decade, but probably in the next half a decade, we will know whether we really have a dengue vaccine.
Just to finish, I want to say that I didn't have the opportunity to work with Francis, but I had the opportunity to work with Claudio that's here. They both work together. And for me, they are some sort of role model or good examples of commitment to public health, to commitment to put the well-being of the populations of people beforehand and to try to overcome all difficulty you face, even sometimes perhaps in expenses of your own needs and congratulations for your boss and thank you very much. I hope that one of you will follow their steps as I have been trying to do. Thank you.
Sure. Follow your passion.
Follow your passion,
something.
that's good. Claudio, do you want to say something?
No, I think
Why did you
talk everything about all the points. Smallpox is finished, and Brazil take the model of smallpox. 19 years after smallpox eradication, they did another eradication. Every control, measles, another disease, hepatitis, has been done to the saga of the smallpox eradication program. But more important, and the work has been done by Don after the smallpox, is to find out some protection against the devastating disease as dengue problem. And I think we look forward to have this new vaccine and to give it to Brazil and other countries in tropical areas for to finish also this disease is make married people and it's a big problem in public health.
I want to say something about Claudio. We had the victory in Brazil of the battle against polio, and nowadays measles is almost eradicated. I mean, it's under control. There was an outbreak a few days ago in Rio Grande do Sul that's being under control. And Claudio in the early 80s, I used to work with him, and he was very enthusiastic about the control of measles. And he planned and he directed and he did a program of mass vaccination to control measles in Rio de Janeiro. That was he succeeded in reducing the deaths of measles about 1,000 cases from 1 year to the other, isn't it? Now after that, the measles program expanded all over Brazil, following his example and his energy to do it. And
After 20 years.
After 20 years, yes.
20 years old.
Sorry?
We vaccinated 20 years old.
Oh yes. And
Extended the age.
from children to young adults.
Because more important is the residual to remain in the community and is left the disease, wait the children come up to make epidemic. Sometimes in Brazil was dying in Rio de Janeiro. Each year we lost 1,000 boys per year.
Yeah, I know, I remember, yeah. Well, we are all here to celebrate in the next few days in Fiocruz the 30 years, or a bit more than that, of worldwide eradication of smallpox. And the challenges ahead will be also discussed. And hopefully we'll be able to have many people and youngsters, students, following public health and following their steps to make life better for everybody, isn't it? Okay, thank you.
Thank you.